what you disagree with?
Well, specifically, I certainly appreciate the fact that the President is trying to move us toward a position where all Americans would have what he refers to as health security. In other words, everybody would be able to obtain a basic package of health insurance benefits. That is a concept that I certainly embrace, and it's one I think the huge majority of the American public embraces.
Well, but what you just said, does that mean universal health care coverage?
Well, what it means is universal access immediately and a movement toward universal coverage over a period of a few years, probably 5 years at least. And that concept is one that I think that the huge majority of the American public embraces, and it's one that I certainly embrace. And I'm very pleased that we will be reforming the health insurance industry in this country to deal with the problem of pre-existing conditions, which is a terrible problem for hundreds of thousands of Americans. And in addition to that, we will make health insurance portable. In other words, it will go with the person, not with the job. And these kind of reforms, I think, are going to be enormously beneficial to the American public, and I certainly support the President's attempts to address these very complex issues.
Well, do you think it's a question of semantics in your, is it a question of semantics in your mind between universal access and universal coverage?
No, there's more than semantics involved when we talk about universal access versus universal coverage. Universal coverage envisions that everybody, regardless of their income, will have access to a package of benefits. And universal access just means that these benefits will be available assuming an individual has the ability to pay. But of course, as you move toward community rating, the cost of health insurance will drop dramatically for sick Americans. And I think that is extremely important to understand, that many people in this country who today are paying $800 or $1,000 a month for health insurance benefits would be big winners under the President's health reform proposal or under the proposals that others are talking about in the Congress.
I take it one of the big aspects of universal health care would be employer mandates, which is mandatory really to have universal health coverage as opposed to access. And my understanding is that you disagree with that. Is that correct?
Well, I have three concerns with the President's plan. One of them is affordability. There is still about $120 billion discrepancy in the projected price of the President's health care plan. That has to be reconciled. It has not been reconciled. In addition to that, I'm very concerned about what effect the proposed mandates will have on small business. And I'm working with Chairman Dingell right now to try and figure out a compromise on that question. And then in addition to that, I'm very concerned about the mandatory alliances, this whole concept of forcing everyone in the country to buy health insurance from a government entity. I would much rather see us allow the private health insurance industry to compete with these alliances or networks, however they're ultimately shaped. So if we can address those 3 points, I think that we can put together a compromise package that will hopefully be able to move through the Congress.
I take it small business is a very big concern of yours in your district. Is that right?
Absolutely. You know, small business has to be a big concern of any policymaker in this country that has their head screwed on right, because it is small business that produces the lion's share of new jobs in this country, and the huge majority of our people work for small business. So I think it's extremely important for us to be mindful as to how any policy change, especially one as profound as health care reform, will affect small business in this country. So yes, I and many other members of Congress are very concerned about how this proposal will affect small business, and that's one of the things that the President is coming to Kansas to focus on.
Let's talk a little bit about the stop there, Congressman. What does it mean to have the President come into your district to talk about this program?
Well, Kansans will be, I think, very excited to greet the President of the United States. We're very pleased that he's coming to Kansas, and it will be very good to have him sit down and visit with business leaders in Kansas and Kansans in general about his vision of the future of the country and how health care fits into that. And I think that's what the President will be doing. So we're excited to have him come, and we'll be, I think, greeting him enthusiastically.
And what does it mean to you politically to have him come to your district? Is that a help or a hindrance?
Well, it's always great to have the President of the United States in your district, and I'm excited about the President coming, and I hope that his trip here will help him see more clearly the concerns that I have about his health care proposals. And at the same time, I hope that the people of Kansas will have an opportunity to hear directly from their president about what he's attempting to do with this most difficult of issues facing the country. And I give him a lot of credit for tackling this complicated issue. It would have been very easy to just walk away from it, as previous administrations have done, but he's stepping up to it, and I give him credit for that.
Do you think by his coming, it signals any sort of flexibility, let's say, for instance, on this employer mandate question?
Well,
for you politically.
Yes, well, I think that the president has signaled a willingness to compromise, a willingness to be flexible, and that is absolutely essential to the success of his health care plan in the Congress. And I've personally communicated to him my deep concern about how it would affect small business, and I think that that has to be changed for him to get his plan through the Congress. I've also explained to him my opposition to mandatory alliances, forcing everybody to buy health insurance basically from a government-type entity. I think that needs to be changed. So he understands that, and he understands my deep concern about the affordability of it. Where in the world are we going to find the resources to pay for this plan, and how we're going to reconcile this $120 billion discrepancy in the price that exists between his numbers and the numbers of the Congressional Budget Office?
You know, Congressman, there's been some stuff written recently and, information out and, of course, stories out that the White House has sort of failed on getting their message out on the health care issue, that they've sort of fallen short on that, and some polls indicate that people who were first agreeing with the president's plan, it seems that support is eroding. How does that play in your state?
Well, I'm convinced that the president's plan needs some modification, and I've communicated that directly to the president. I'm working with Chairman John Dingell to achieve some of these modifications, and I think once some of the changes that I am supporting are included, I think that this plan has a very good chance of then garnering broad-based support in this country. I think the American public generally tremendously appreciates what the president is trying to do in health care reform. They may disagree with some of the provisions of it, as I do, but I think those concerns can be addressed, and I think the president has signaled the flexibility to do that. And I think that's the first step toward really getting the ball rolling in terms of getting health care reform passed through the Congress.
I mean, we have some information, Congressman, that either certain members of the Ways and Means Committee or the House and Energy and Commerce Committee that you're on had gone directly to the White House to ask the president to come to some specific districts to discuss the issue. Is that correct?
That could have been possible, but I certainly have not asked the president to come to my district. I did not do that.
But you're happy to have him? I'm
delighted to have the President of the United States come to my district, and I think any member of Congress would be delighted to have the president in their district. And I look forward to having a good conversation with the president, and I think that Kansans will greet him warmly, and I believe that he'll have an opportunity to hear directly from my constituents, and they'll be very direct and very candid with him, and I think he will be responsive to them also.
Have you heard from any of the coalition groups that are supporting the president's program, like the Health Care Reform Project, that seem to be targeting certain districts and certain members that have key votes on these committees to pass the bill? Have you heard from any of those people?
I think I've heard from all of them. Okay.
And what do they tell you?
They're saying vote for it, and they're saying also, in effect, that we don't know how it's going to be paid for. Well, the problem we have in Washington is that there are a lot of politicians that want to promise, and then when it comes time to pay the bills, they want to say, oh, no, by the way, here's the bill, and let's hand that to our kids and grandkids. And one of the things that I'm adamantly opposed to is that I am not going to vote for any more entitlements that basically hand the bill to our kids and grandkids, and that is something I will not compromise on. I'll vote against the whole thing in a heartbeat if I believe that it's inadequately funded or if it's going to cost way more than what the American public is willing to pay. So the bottom line for me is it going to be paid for, and if so, how and by whom? And that's a very, very important question as we move forward with this debate.
Sounds like the president has a lot of work to do with you.
Well, I'm looking forward to working with the President, and I feel very strongly that we must move a health care reform package through the Congress this year. And I want it to focus on health insurance reform. I want it to move us toward immediate universal access. I want it also to make sure that every child in America under age 18 has immediate access to a basic health insurance package. I want us to standardize the health insurance benefit package nationwide. And these are some of the things that I think we can and should do immediately. And those would be monumental achievements if we can get that through the Congress this year. And hopefully the President will be able to lead that effort, and I'm confident that he will.
Yes, back to these some of these grassroots efforts by these outfits like this Healthcare Reform Project. I guess they're doing a lot of literature campaigns and some TV commercials. Have you seen any of them, or have you had any reports from your home offices there that they are running into districts and how they may be playing?
Well, I've seen some of these pamphlets, and there's no question that there are some very compelling reasons why the President's plan or something like it should be passed. And certainly they are going to try and articulate those concerns to the people, and that's great. That's what American politics is all about. But I think it's also very important for us in this health care debate to focus not only on the benefits that people will receive, but also the cost and how the cost is going to be paid for. If we don't do this, what we will have is a repeat of the catastrophic debacle of several years ago when the Congress passed catastrophic health insurance, and then when the American people focused on how it was going to be paid for and who was going to pay the bill, they said, no, thank you, we're not interested, repeal it, and that's what the Congress did. Now, the worst possible outcome is for the Congress to deal with this issue in sort of a very quick way, and then have to come back a year from now or 2 years from now and repeal a big part of it because the price tag is far more than the American public is willing to pay, and they conclude that they don't want it. So let's go slowly as we have the President's focus on this issue. Let's make sure the American taxpayers understand it, and let's make sure that they embrace it before we try to shove something down the throats of the American public. Because if it's not something they're going to really be comfortable with, they will reject it soundly when they fully understand it.
Well, you know, I'd like to go back to one thing that you said, and I think most people would agree, and I mean not only political representatives, but people in general. I think they're always happy to have the President of the United States come to their state or their home district. But in this case, don't you think he's coming to twist your arm to get your vote for this plan?
Well, I don't think there's any secret that the President is making a visit to the Midwest to probably try and convince Congressman Hoagland in Nebraska and me and perhaps Congressman Brewster in Oklahoma and others in the Midwest to embrace his plan. And I think our message to the President, certainly my message to the President, is, Mr. President, we appreciate very much your leadership. We appreciate the fact that you've really taken this very difficult bull by the horns, and we want to work with you. There are some concerns that we have that need to be addressed. One, affordability. Two, we have to make sure that this is something that small business can live with. And in addition to that, we have to address this question of mandatory alliances so we don't get too much government involved in this. I think one of the biggest problems the President confronts right now is the American public's overwhelming skepticism about the involvement of government in this area beyond where it already is. There's just enormous distrust of government in the country today, and I don't think the President's going to be able to sell his plan until he addresses that concern.
Do you think he needs to do more trips like this and get out into the districts like yours and really hammer this issue home?
Well, I think that the President needs to travel as much as he can. I think that it's also going to be very important for him to listen very carefully to real Americans who are concerned about provisions in his health care plan. Those concerns will be reflected in the votes of members of Congress. And the only way he's going to get their votes is to respond to their legitimate concerns. That means he has to respond to the question of the cost of the overall plan. He has to respond to the concerns of small business people in this country. And I think he also has to respond to the concerns of those who are very worried that this is a big government expansion effort. And that is something that is resonating with the American public. So on those three counts, the President has to be responsive if he hopes to get his plan through the Congress. And I hope he does respond, and I hope he does get a health reform package through through the Congress that we can all be proud of, and one that he can happily put his signature on.
Well, I think that sort of covers it for me, Congressman. Is there anything you'd like to add?
Great to have a chance to visit with you. Come to Kansas. Spend some money when you come here.
We really appreciate you doing this. I know it's sort of cumbersome to do it this way, but we really appreciate it. It's been a great help to us.
We're delighted to have anybody from the East Coast come to Kansas, even ABC News.
Thank you. I appreciate that. We'll hope to see you on Thursday.
Okay.
Thanks again.
Okay.